Okay, doctor, not taking much of your time. Let's begin for the session for the day. Doctor, can IVF be done for the second child, for the birth of the second child? क्या कर सकते हैं ये?
Yes, definitely. See, IVF is an technique, right? As you rightly mentioned, is an assisted reproduction technique. So, IVF can be done for first child, second child. That's not the criteria. The main thing that usually, couples feel is like most of the times they feel is like, first we conceive very easily and the second child is taking a lot of time. So do we need to do an IVF or what is it? It's not always like that. This is like if you already have a child and then if you are trying to conceive and if you don't conceive, then it is called as secondary infertility. There are different parameters when it comes to investigation of a couple who already have a child. We need to do a detailed investigation history and everything has to be taken into consideration. Yes, answering your question, definitely IVF can be an option for a second child if it is genuinely indicated and if there are certain, we have certain criteria which have to be fulfilled when it comes, and then yes, definitely we can give second IVF for a second child.
Okay. Thank you, doctor, for answering this. Is IVF easier for the second time? जब हम IVF का procedure for the second baby कर रहे होते हैं second time के लिए, तो क्या ये easy होता है थोड़ा parents के लिए rather than first time?
See, we can categorize the patient like in two types. Firstly, a person who has already conceived the first child through IVF only, and a person who has first conceived the first child naturally. So a person who has conceived the first child naturally and the second time they are trying and they are not getting pregnant, then yes, if certain parameters have changed with her age, her AMH is falling down, or various other reasons because of which we give that couple an option of second, for the second child, we give them an option of IVF. For them, it is slightly difficult because they have conceived the first child very easily. Probably and naturally, so they didn't go through a lot of trouble, they didn't go through so many investigations, tests, and so much counseling was not needed. So a lot of couples, for them it is difficult to accept that for the second child they have to undergo a procedure which is not natural. I would not say not natural, but something that is not very easy. So for them it is slightly difficult from the patient's perspective, because that is where they have to understand that it's a long procedure, it's a month-long thing, they have to visit the doctor more frequently and they have to take injections on time, they have to do certain things on time. So for them, from their perspective, it is difficult. And it is difficult for them to understand all these things, all these steps have to be followed, all these precautions have to be taken. So for them it is slightly difficult. But for a person who has already conceived a child through IVF, most of the times they are aware what precautions are to be taken, what kind of commitment is needed, what kind of you need to be following up with the doctor, you need to go. So basically every IVF pregnancy, whether it is your first or second child, needs a particular line of management, because we are kind of mimicking what happens naturally in the woman's body. So that kind of regular follow-up, regular visits, more tests, more sonographies, and everything is needed. And when it comes from a doctor's perspective, if you see, convincing a couple who has already conceived once naturally for the second time to undergo IVF is slightly difficult, because that is what they feel like, हाँ हमारा तो हो गया था last time, we are okay, why do we need IVF? So at that point of time, we need to make the couple understand that okay, age is a very important factor, wherein her egg quality, the number of eggs of the the female partner have reduced. So for that reason, we may need to do an IVF to make sure that we get results faster. Or sometimes because if the husband's semen count or the sperm quality is going down, for that reasons it has gone down really low, then we cannot do natural or an IUI, we need to do an IVF. So yes, so to somebody who has conceived naturally once prior, for them the second IVF is definitely something that is difficult from their perspective as well as from the doctor's perspective.
Okay, thank you for answering this. Now, how maternal age acts as a factor in IVF for a second child?
Definitely. Yes, definitely. It has got a huge impact. If you ask me, it is a very important factor when it comes to determining the success of IVF. So basically, we always say that in infertility, male and female are equal partners when it comes to the contribution. Both factors are equally, important, and that is true. But when it comes to IVF, slightly female factor is more important, because even though the sperm count is less, we manage, because we are actually doing ICSI or something called as intracytoplasmic sperm injection. So even if the count is really very less, we can actually do an ICSI and get the embryos. But we need those many number of eggs or oocytes from the woman. So for that, we need her to have a good egg giving capacity and a good egg quality. With age, as the woman ages beyond 35, the number of eggs that we can we get in a IVF cycle are less. The reproductive capacity of a female goes down beyond the age of 35 slowly. It starts from the age of 18. With every cycle, the number of eggs that are there that the woman has, it slows down gradually, and beyond 35 the quality of the eggs also go down. So yes, the age of the woman is a very important factor. So that can be proven with the help, that can be tested with the help of a blood test, which is called as serum AIIMS, which gives us a fair enough idea what is the egg giving capacity of the female, and what is her fertility potential, what is her what kind of medicines or injections she will need, how much time will it take, how many number of oocytes we are expecting in a IVF cycle, and these things. And this AIIMS is like a value which will keep on going down. So it's like a bank balance which will keep on going down. It won't increase, because the females won't get eggs, new eggs. Whatever they are born with, they are born with. So as the age advances, the number of eggs also go down. So that is one thing that is very important when it comes to the initial part, like the IVF cycle as such, in which the number of eggs that we pick up matter and number of embryos that we get matter. So that is one thing. And secondly, once the female gets pregnant, so post IVF, in pregnancy also, with increased maternal age, increased age of the mother, there are multiple complications that happen. There have been numerous studies where we know that, with advanced maternal age, there are more medical complications, like there are more chances of getting GDM or gestational diabetes mellitus, that is diabetes during pregnancy, or more chances of preeclampsia, eclampsia, that is increased high blood pressure during pregnancies. There are increased chances of placental complications leading to IUGR, and then preterm babies. So all these complications are found more in advanced maternal age. So that these two ways the age of the mother affects IVF.
Doctor, like if when the parents are going, or the couple is going for the second time for the procedure of IVF, what are the pros and cons of it for the second procedure?
For the couple, right?
Yeah.
So like I said, pros and cons, what I would suggest, what I feel is like basically somebody who is conceived naturally, maybe in their 20s, and then they haven't conceived for the next few years, and now they are in their 30s. For them, IVF is a good option when it is indicated. Like a lot of times, because of the stress that has occurred throughout their life, the male partner, the sperm count of the male partner goes down drastically. So for these couples, even if they want to, like everything is right with the female partner, just because the count is low, or sometimes they become azoospermic, like they don't produce sperms. For those, those conditions or those indications, IVF is a very good option, because then previously, like if it was not there, they had no options, they would never conceive. So that way it's a very good option for somebody who has the sperm count has gone down or something like that, where it was a uncontrolled factor. That is like a very good thing for the second child. Like they can have a second child if they want to. And another thing is that if you have done IVF, we also do something, we use if we have frozen embryos of that couple, we can use them later to transfer as their, they can conceive after later. That was something called as social freezing. But obviously with the new ART bill and coming, we don't have clear-cut guidelines yet as of now on those things, so let's not touch upon that part. But yes, definitely that was an option. They could have the, like, suppose they wanted a child after a few years or something like that, that could be done. And cons, I don't see any cons as such, but just the thing that they need to be more, it's not very easy. They need to be more proactive. They have to be very, they have to be up to date with the injections, medicines, take care of everything. So they have to be very, it's not like, they just got pregnant and they realize after 2 months or something like that. It is a tough journey for the mother. So I think as a couple they need to be together, because most of the times these couples are like in their 35s and 40s or something like that. So they need to be ready. Firstly, they need to be sure that they are mentally ready to start over, and then they should be willing to do it. That's one thing. But other than that, if they are willing, I would recommend to do it when like less than 40 years of age, because beyond 40 the complications that are there with pregnancy also increase, and then it is more of a very high risk pregnancy.
Doctor, what are the success rates of the second IVF treatment when the couple is going for the second procedure of the IVF treatment once he had already done? So तब उसके success rates क्या होते हैं? Do they decrease or they don't have any effect?
I don't see any change of, see, basically the success rate of IVF changes with the indication for which we have done. And, if it is somebody who is the female partner is very old, her eggs are of poor quality, and then the embryos are also of poor quality. So there are multiple factors when it comes to the success rate of IVF. So we cannot generally, generalize it. But like I said, so most of these couples are beyond 35 and somewhere between 35 and 40. So if you are thinking of having a second child through, if you are wanting to have a second child, meet a fertility specialist as early as possible, because there are ways, methods, medicines with which we can improve the egg quality, in short, improve the embryo quality, improve your chances of getting pregnant through IVF. And then in short, the earlier you get pregnant, lesser complications.
Doctor, what are the advantages that you would suggest when the person is going for the second time for the procedure? What are the 3 advantages जो उनको मिलते हैं जब वो second procedure के लिए जा रहे होते हैं, second time जा रहे होते हैं procedure के लिए?
Advantages, see, they get, the chances of success of IVF are much better as compared to natural planning. So that is one thing. Then if they want to plan a pregnancy around in specific year or something like that, even that can be done. Like, it can be programmed, because that is when they want, suppose if they want to get pregnant this year, suppose they want to get pregnant next year, so that can be done. And yeah, that's it. Like mainly those 2 things, because it's that is what they can do.
Doctor, like there are so many medications given during the procedures, like first procedure में भी होते हैं, second procedure में होती हैं. So what are the disadvantages of when so many medications are given during the second time procedure of the IVF?
See, there are no disadvantages as such when it comes to medicines, because these medicines mimic what is happening in the body of the female. So these are not, they don't have side effects as such. What we do is we try to mimic what is normally happening in her body, and then we manipulate those hormones in physiological doses, which won't cause any serious side effects to the body of the female and or to the child. So they don't have any side effects. It's just that it is more of a sense, like I said, it's more of time sensitive and everything. Like we have to manage it, and we have to give her daily doses or daily injections, because naturally, normally her body is doing the same thing. So we need to mimic that. So we have to be more on, more on toes and do everything and make sure that, the cycle is in a regular this thing. And medicines and injections are given daily, or whatever is the dosage according to that.